Welcome back to Good Day Chicago. It is 8:38 on this Wednesday morning. Having children is something a lot of people see as a natural part of life, but for many women, for many couples, it's just not that easy. This week is National Infertility Awareness Week, and I'm joined right now by Dr. Ed Marut of the Fertility Centers of Illinois. Dr. Marut, thanks so much for coming in. We've spoken before. This is something you've been doing for years, and you're very familiar with. So I want to start with the very basics. It seems like we've been talking a lot about IVF and about fertilization. Is this something that has been popular for a long time and we're just now hearing more about because the taboo has been lifted, or is this something that's happening more often?
It's a number of different things. One is that the success rates have gotten so high over the last several years that people are more willing to do something which is fairly high tech and unfortunately can sometimes be expensive. But I think people often come in being afraid that they're going to be told, you got to do IVF right off the bat.
Right.
When most people don't. And you can start with much more conservative treatment. And I think that's one of the things to allay the fears of patients. If I go in there, they're going to want me to do IVF. That's not really the case.
Yeah, I bet there are a lot of misconceptions out there just because it is something that hasn't really been at the forefront of the national consciousness until lately. So what are some of the other big misconceptions out there?
Well, wow, the biggest thing is about age. And I think that, that people come in and it's kind of ironic that younger women think they're older and older women think they're younger from a reproductive point of view. And they feel that, gee, I'm in my 40s, but I can run the Ironman and I can do a triathlon. That doesn't make your ovaries healthy. It doesn't make your ovaries young. And I think people have to be more aware of the fact that age is the biggest deterrent to getting pregnant, and they should seek help sooner rather than later.
I mean, this is a conversation that I've had with so many of my girlfriends who are in their 30s, in their 40s, about infertility and what the factors are that we're facing. Is the partner a factor, the male partner? I mean, that has to come into play somewhere, right?
Huge, and I think that men have gotten a free ride for a long time because of all the stories of celebrity fathers in their 70s and 80s. But the fact is, men have an aging factor as well. Somewhere in their mid-30s, the quality of the sperm starts going downhill. And in fact, that the things that men are doing in terms of their health, their weight, their habits, can affect pregnancy acquisition as well as what the woman's doing. So when we talk to a couple, we try to get them both to a good weight, stop smoking, stop drinking, live healthy lifestyles in preparation for getting pregnant.
Do you think, you talked about the success rates and that being one of the reasons we hear more about IVF these days, but do you also think that fertility problems are more common, perhaps? I mean, I know we constantly are seeing articles, be it what we're eating in our diets, how long we're waiting to have children, we're putting our careers first. What do you think the problem is?
Well, I think that a lot of the social aspects are people are delaying pregnancy longer. And again, age keeps coming. I have to keep beating on that. That age is the biggest factor. And our parents' generation, people are getting pregnant quickly. People were doing it early on, and that makes a factor. So it's not just the aging of the eggs, which is the biggest thing, but there's more times for things to go wrong. So in a woman's life, more chances for her to have endometriosis or infections or ovarian cysts. So a lot of it is the social fact that people are delaying longer to get pregnant.
And last question, doctor, what would you say to women who are watching at home, who are anxious, nervous to see a specialist, just wondering about their own fertility situation?
Well, I think there's a couple different things. I mean, Fertility Centers of Illinois has an easy method called Fertility Awareness, where a woman can get a very good snapshot of her own ovarian reserve. How many eggs does she have left? What's the prospects there? That combined with her age, I think will give somebody a very easy way to assess things without having to commit to anything. And again, knowing that when you go into a reproductive endocrinologist at Fertility Centers of Illinois, we don't push people into IVF. We say, what are the most conservative things we could do first to help you get pregnant at the easiest methods? I tell people sometimes sitting in that chair in front of me may all that they need.
Amazing. Thank you so much, Dr. Ed Marut from the Fertility Centers of Illinois.
Welcome.
We appreciate you coming on. It's such an important conversation to have and something that touches so many women out there these days.
Thank you.
We appreciate it. All right, Corey, back over to you.